VACCHO again for the Croakey Go Walk, and this time we've got VACCHO Acting CEO Trevor Pearce with us. Welcome, Trevor.
Thank you.
Could you first of all please tell us who your mob are?
So I'm in New South Wales. I'm a Gamilaroi man from Western New South Wales. My mother's country is Coonabarabran to Moree, and I've lived in Victoria for over 30 years now.
Fantastic. And can you tell us a bit about some of the highlights of VACCHO's year this year?
This year's been a very, very busy year, certainly around the issues of self-determination for the Victorian Aboriginal community has been very strong on our agenda, working with government around making sure that they hold true to that, and it's reflected in everything they do. It's a major policy they have. And that's manifested itself in a prioritisation of funding. So Aboriginal dollars need to be in Aboriginal hands when it comes to Aboriginal health, rather than it going off to mainstream.
Fantastic. And VACCHO's been in the news this week about a small survey that we did about racism in the health system, in the Victorian health system. Could you please tell us why that's an important issue for us here at VACCHO?
So Aboriginal people are 4 times more likely to discharge against advice, particularly from hospitals. And what we know is the cause root of that problem is racism. That Aboriginal people are questioned about their identity continually, or are stereotyped about who they are, and that prevents people from access. People get fatigued, when you continually have to justify who you are as an Aboriginal person. You're sick already, so it's about they're the major challenges. So what we do know is about 80 to 90% of Aboriginal people in the state of Victoria in the last year have experienced some form of racism, be it casual, be it ignorance, when they've entered the health system. So it sends a very scary message to people that you need to leave your culture at the door. But culture is a healing factor. It's critical for health and well-being. So they're the challenges that we've had to face this year, and that's what the research has shown us.
I think some people were shocked by some of the results, thinking, how can it be that high? But when you include things like casual racism, it might be something like, oh, you don't look Aboriginal, or what percentage of Aboriginal are you?
All of those things come up, and if you're in hospital and you're in there for a week or so, and every time that there's a change in the ward staff and the nursing staff change, and they all look at your folders, your files, and often the question is, oh, you're Aboriginal, or you don't look it, and I personally have experienced it, oh yes, I've worked with Aboriginal people before, they've all been on dialysis, so the assumption is that you're an alcoholic, so for some of our mob, they don't talk about it, which is not what we need. We need people to identify that they're Aboriginal or Torres Strait Islander, because it gives us a very clear picture of what's happening, where the gaps are, where we need to be servicing our mob. What we do, an additional thing that we do know is that we access services at a much later date. So rather than getting on top of it early, it's the pointy end of the sticks, it's the crisis end, it's the tertiary end. And then it's often too late, or there's damage done that is irreversible. So it's about making sure that people feel comfortable about who they are. Taking blood is taking blood pressure is taking blood pressure. That still has to happen. But it's the relationship that you build with your patient and your client that's important, for them to feel comfortable to access your services.
Fantastic. And VACCHO has put together some asks for the Victorian election, which is happening next week.
Yes.
It's crept up on us very much so, but can you tell us a little bit about what VACCHO is asking for anybody who comes into government?
So what we are asking for, first and foremost, is that closing the gap is just a big thing. It's such a big thing, and we perhaps need to look at, the narrative around that and changing that narrative. So the biggest ask we have in there is that if we have these problems, they need to be looked at and considered. So we would like to see a Commissioner of Aboriginal Health in the state of Victoria that has the ability to give us the big picture stuff, but also to drill down into some of the everyday stuff to explore some of those experiences of Aboriginal people, but also to explore some of the experience of the other side of the fence, for want of a better way of putting it. So what are the barriers for the health system and getting Aboriginal people to access it? And how do we build from that? I think that's our biggest ask we've got. Certainly the ability to keep walking with us as community and to listen to us. And to be a part of that. Certainly the stuff around self-determination as should be paramount. If we're to see tangible changes in our society in relation to Aboriginal health and wellbeing, these things need to happen.
And I believe you're asking for investment in prevention, not detention.
Yep, certainly we know that we're unique in Victoria, and our Aboriginal organisations aren't just health organisations. We have a holistic wraparound service. So you can come to the Aboriginal organisation in Victoria, we have 30 of them. It can be through a justice door, it can be through a health door, it can be through a housing door, it can be through a whole range of doors. So it's about that holistic view of health. It's not just the absence of disease, it's the social, cultural and emotional wellbeing of the individual, and justice is a big thing there. It's about, what can we... A lot of money is always spent at the tertiary end, and that's band-aid work. It doesn't address the cause of those problems. We will always have tertiary problems. We're realistic about that. But unless government starts spending at the early intervention end, we will see those continue. We need to lessen them, So certainly tertiary and secondary services need to be better supported. Primary and tertiary secondary services need to be better supported.
Fantastic. Thanks for your time, Trev.
No worries.
Thank you very much.